Okay, hello, assalamualaikum, and good morning, everyone. It's good to see you guys again. But again, this time we're going to meet in the pre-recorded class. Alright, so first of all, I would like to apologize because I cannot conduct any online class because I got a wedding to attend because I paid a bridesman for my friend. Alright, so without wasting any more time, today we're going to learn a new chapter entitled Exercise Guideline. So don't worry, it's going to be quite a short topic, I think. Okay, right. So let's start. So first, we go to the first part, which is the skeletal and muscular system. So this is the fundamental part before you know the general guideline for exercise, because our skeletal and muscular system is important for our body. All right. So this is some facts regarding our back muscle. Alright. So at some point in their life, 80% of the population will experience back discomfort. So by the meaning of 80%, it actually means that around 40% from the 80% is actually people who age above 40 years old and above. Alright, so back problem represent 40% of all missed workday due to the injuries or illness. So when you guys have a back problem, for example, like a sickness or back pain, you guys cannot do any physical activity because it's actually interrupt your daily life routine. For example, like you guys want to clean the house or you guys want to do other stuff. Alright. So back pain, as I mentioned earlier, is the leading cause of inactivity among those aged 45 years old and older. Alright, so usually people who age above 45 years old or even 40 can be diagnosed with back pain. But this is actually not true because recently there's a study that demonstrates that people with our generation, which is young adult, like me and you guys, 21 until 30 years old, also experience back pain. So why we experience back pain? Because first, maybe we will not do the exercise properly, or maybe we put too much pressure in our back, or because next one maybe due to our weight. All right, our body uh, cannot support the weight of our body. All right, our back cannot hold the amount of weight of your body. All right, so that's some fact regarding our back injuries. So now we proceed with the more complex part, which is the anatomical term. This is quite unique, so you guys can uh, feel like a doctor when you guys know this term. All right. So the first one is hyperextension. So this is actually the process when we strengthening uh, and increase the angle between two joints. All right. So hyperextension, you guys might remember when we hyperextend our joint. For example, in the picture, we hyperextend our neck. So like this. And for the hand, but when you push our hand beyond its limit. So this is hyperextend, alright? So next one is hyperflexion. So hyperflexion is actually a bending between a joint in its natural range. So this is actually driven with hyperextension because hyperextension we extend it beyond our comfort zone. But for the hyperflexion, we extend it based on our comfort zone. All right, we extend it based on our normal range. All right. For example, like yes, we put our necks down, we push our wrist. I'm sorry, our wrist down. So this is actually the normal range. All right. So far so good. Of course, you guys cannot answer me because this is a pre-recorded class. Sorry. All right. So the next one, yes, the biological term, the Valsalva maneuver. Have you guys heard about Valsalva maneuver? So actually, Valsalva maneuver, based on the note, it said that increase the pressure in the thoracic region, resulting in ventral fainting or dizziness. So actually, this is not quite accurate. So Valsalva maneuver is actually the maneuver that we use when someone is choking. All right. So um, based on the note, it said that put the pressure in our thoracic. So where is our thoracic? You guys know? So the thoracic is actually our rib cage. Alright, so this is our thoracic. Alright, so when we put the pressure here, we can actually push or the choking material. Alright, so for example, how will it work? Sorry, let me demonstrate to you. So This is put your hand like this, and then put this near our sternum. I want to show. No, no, I cannot show you. All right, so near our sternum. So this is sternum. All right, uh, our chest bone. Yes, our chest bone, the sternum one. So below sternum here, you can see there's actually a space. All right, below it, there's like a space here. So you put your hand like this. You put it here, and then you do a jerking movement right below the sternum. One, two, and then it can put the pressure in the thoracic, and the pressure will actually push the choking material. All right. So I hope you guys clear about this. But if you guys don't understand, please feel free to ask me. All right. Next one, the body posture. This is the serious part. Usually that our Malaysian people don't care about the body posture, right? So which lead to the serious injury as we get older, all right? So body posture. A good body posture. So based on the picture, we can see that when someone is actually, we call it a bongkok, bongkok. Yes. Not straight chest up, lock back. Yeah, they have a bad body posture. So a good body posture can help to reduce the pressure on our vertebral joint and ligament. So where is our vertebra? So our vertebra is actually our back. This is the vertebral bone. All right, our backbone. All right. So this is actually backbone is actually the critical part in our body because this is where our nerve been located. All right. If you damage one of the vertebral, or we call it, it can be divided into C1, C4, T1, T2, something like that. If one of the area being damaged, yes, it can result either you cannot, you've been paralyzed, or either you cannot, you have a slip disc. All right. So the segment of the body are symmetrically about the center of the gravity. So it means that the correct posture is when you stand straight, yes, your back and your chest up. Alright, so this is the good posture. Alright, I hope you guys can see. This is a good posture. And the bad posture, yes, when you doing like this, so it actually put the pressure in our backbone, and our backbone as you get older, it will be in the shape of you, and not in the straight shape, which is not good. Alright, so next part, the element of good standing posture. Alright. First of all, the element of the good body posture. Head center at the chin level. Alright. So this is the example. Head center at the chin level, straight like this. Chest height. Alright. So it means that yes, you put your chest height, but not so high. Alright. Just a normal. Just a normal. This is head center at the chin level. Chest up. Alright. Chest up like this. And then the shoulder down and back. Alright. Not too high shoulder. Just down like this. Alright, and then abdomen flat and suck and tuck. Alright, so just when you lock your back, your abdomen will automatically be flat. Alright, just lock your back, turn straight, and then the last one, knee straight and relax. Alright, let me show you my knees. Alright, so knees straight and feet parallel and weight balance. Alright, so as you can see. So weight balance, feet is parallel, the weight balance, not like this, not like this. Just like this parallel. So the weight distribute in this our area is balanced. Alright, the gravity area here is in good balance. Alright. So that is the element of a good standing posture. Alright. So the cause of poor posture, the first one is heredity. Of course, yes, heredity, the legacy. If you have a family who have a poor body posture, yes, you might inherit the poor body posture from your family. Alright, this actually can be avoided if you're aware about the poor posture of your family. You guys can avoid it by start to practice to have a good body posture by walking in the correct posture during the young age. The next one is the poor fitness. Of course, if you have a poor fitness, all right, you don't physically active, right? Your body, your backbone cannot support your body weight, which is cause a lot of people to suffer with the back pain, slip disc because of they have a poor fitness. Your body adaptation is sucks. All right, lack of knowledge. Obviously, most of the Malaysian people have lack of knowledge regarding the good body posture. All right, so they just have a posture that's suitable for them, all right? But it's wrong, which cause to a lot of back pain. And the next one is a bad habit. Of course, for Malaysian people, yes, we have a bad habit. We tend to, yes, stand like this. Alright, even when we sit, we not sit straight. We sit same like this. Alright, which is a poor habit to do at such a young age because you get older, yes, you will suffer. The next one, the postural problem. Yes, the scoliosis. Have you guys heard about the scoliosis? No. Alright. So scoliosis is actually one of the most extreme condition of the back problem. Alright. It's actually characterized by the curve of our spine. Alright. So usually our backbone usually will be straight, but the scoliosis actually cause our backbone to have a weird shape, maybe like the C shape or either bend the other way. Alright. So it's actually caused maybe because of the heredity. Alright, the heredity of your family, or maybe because you have a poor fitness, but usually it's because of the poor heredity. All right, you inherit it from your family. So as for the treatment, it cannot be treat, but you can reduce the level of scoliosis by use the braces, exercise, or even for the serious part you do the surgeries. All right, that is scoliosis, which is the serious problem for the back. Next one, lumbar lordosis. So the lumbar area, which is the lower back, or our lower back, is the one of the most prevalent condition. It's characterized by our sway back, alright? And due to the weak abdominal muscle is our abdominal, our stomach, and short hip flexor, alright? Due to the short hip flexor. So as you guys can see from the picture, the normal spine. Yeah, the normal spine it's actually straight and don't have any curve. But for the lumbar lordosis, it's actually go inside. So you have to work. You have to you be like this when you have a lordosis, right? Which actually put the pressure at your backbone, right? So in order to prevent lumbar lordosis, as I mentioned earlier, yes, exercise and practice good body posture during our young age. All right. Next one, a proper posture. How to balance the muscle strength. In order to have a good posture, you must have a long and strong back muscle. How we can do have a long and good back muscle? Yes, of course, we have to do the physical activity or even workout. Either you go to the gym, you or even if you don't want to go to the gym because you're shy, because too many people, too many gym rats, yes, you can do the body weight workout also. Or even if you don't want to work out, just do the simple stretching. I already teach you the PNF stretching if you guys remember. So you guys also must have a strong abdominal muscle. Yes, this you must do a workout. All right, workout with your train your core to have strong. So when you have a strong core, it actually can support your backbone. All right, and then you must have a long, strong hamstring muscle. Of course, our hamstring here, lower here is our hamstring, and the long hip flexor muscle, which is our front here. So actually, the back part of our body is actually related between one each other. So let me demonstrate. So if you have a strong abdominal, it actually can support your back. So if you have a long and strong back muscle, it actually can support our abdominal. Alright. So if you have a strong hamstring and also a strong hip flexor muscle, it actually can support our back area as well. So it's actually all related. So if you guys start to have an injuries in the hamstring area, it actually can lead to damage to our back because our hamstring cannot support the back because it will be damaged. If you have a weak abdominal muscle, yes, the abdominal muscle cannot support our lower back. Same with our back muscle. If you have a weak back muscle, it cannot support our abdominal. Alright, so it's actually related with each other. Okay, let me see first. Shit, it's so far away. Alright, next strategy for promoting back health. So postural. So this is strategy. The first one is when you're standing, always maintain a flat lower back. So what it means? Let me demonstrate. So when you're standing, always maintain a flat. This is what you mean by always maintain a flat lower back. So this is what it means, flat low back in a simple way. So when you sit, refrain from slouching. So when you sit, it means that stop sitting like this. All right. So sit straight, chest up. All right, low back. So when you're lying on your back, keep your legs and hip bent, and avoid lying on your stomach. All right. So don't wait. Don't put like this. Don't you stay like this in your bed. If you want to stay like this, please put the pillow in your stomach. It's actually to prevent the pressure in our back. Use a firm mattress when you sleep. This just ignore it. Not so many people can afford a firm mattress. All right. The physical, yes, strategies. The first one, as I mentioned earlier, develop the abdominal strength. So if you have the abdominal strength, yes, it can help you not just support your upper back, it can help you be confident. Either you're a guy or the girls, all right? You can be confident in the public or even at the beach, right? And then develop your hip extensor, all right? Of course, develop your hip muscle, all right? Flex the hip flexor and stretch our hamstring, all right? This is doing the physical activity. The next part, behavioral. Yes, the behavioral, which is the important part, but usually the Malaysian people didn't care, all right? So avoid risky exercise. Yes, this is a serious part, guys. So usually, most of the people in Malaysia, right, they love to do the exercise that risk for their back. For example, they want to do the deadlift. The deadlift exercise, yes, it's actually a good exercise for our back. But if you guys don't have a proper knowledge, a correct knowledge regarding deadlift, and you guys can do it with the proper technique. Yes, it can actually damage our lower back. Usually, this is the example of deadlift. Alright. So usually people tend to do deadlift with a poor posture, not with the correct technique. Usually they sit too low and chest up. This actually put pressure. When you do deadlift, don't sit too low. Alright. Just sit half, lock back, chest up, and when you're ready, just lift and lock it back, and then do again. Alright? So that is one of the risky exercise that most of the people love to do. Alright? Avoid the quick and jerking motion. Yes, avoid any jerking exercise that can damage our back. For example, like side to side jump like this. That can do cause our back. Alright? And avoid lifting and carrying properly. Yes, if you want to lift some stuff, please do it properly. Don't put too much pressure. If the stuff too heavy, don't push yourself. All right. Next one, body mechanics. All right. Body mechanic during lifting. Oh, I'm sorry. I'm sorry. I'm sorry. Damn. All right. Body mechanic during lifting. So based on the picture, this is the wrong technique when you want to pick up a stuff. Why? You see, when you're standing straight and you put your body below, without bend your knee, it put the pressure at the back area, which is sucks. All right. So in order to have lifting something, yes, maintain a close distance and wide pace. Right. So what you mean like this? Let's do some stuff. All right. Let's go back here. Oh shit, you cannot see. Okay, so let's go my back. So in order to correct the stuff with the proper technique, all right. So maintain a close distance and a wide pace. So open your leg. Uh, Bigger. So when you have a bigger base, you have a bigger gravity. Alright, so it can support you. And then close a distance. So sit like this, and then maintain a lordotic curve and bend at the knee and hip. Same like what I do right now. And then keep the close distance with the stuff, and then uh, leave it. Alright, don't hyperextend. Don't lock your back. This is not a deadlift. You want to lift the stuff. Alright. Okay, next part. Let me take my chair first. Okay, next part. What is it? Oh shit. So next part. Yes, the example of good versus bad lifting technique. So this is what I meant earlier. You see the difference? One have a arch back and the other one have a good straight back, which is perfect. Slouching increase strain on the lower back. Of course, when you're slouching in the chair like this, it put pressure in the vertebra, this in our backbone, right? Potential factor of back and neck pain. Alright, first one is the muscle tension. Alright, and then the arthritis. Right, the disease of the bone spur, which is we call it as the bone pop, degenerated disc and herniated disc. What this is mean like a slightly dislocated of the backbone. All right, and both of the degenerated and herniated disc is actually the condition that have a high risk with age. But this is normal as you get older. Yes, our physical function will deteriorate or will slow down, and you can be diagnosed with both of these diseases. All right, cause of back pain, right? I'm sorry. So the disc to degenerate with age and the room for the nerve root decrease, as you can see in the picture here. All right, this is our backbone. As we age, right, our disc degenerate with age, which is our bone vertebra will slow down, and our room for our nerve root will slightly to decrease. It actually gets smaller. If you guys can see the picture of A, you can see the nerve root, and the nerve root is actually bigger. But at the picture B, the nerve root start to become smaller because our bone start to spur and our disc starts to degenerate, which put too much pressure at our vertebra. All right. Consequences of poor exercise. Yes, certain exercise and motion pose is a risk to the back and should be prevented. All right. Risk of hyperflexion. Yes, hyperflexion. Don't put don't hyperflex too much. All right. It can actually cause damage and risk of hypertension movement as well. All right. Example of back exercise and safer alternative. The neck stretch. All right. The neck stretch, for example, like this. Like this. And the back stretch, this one I cannot demonstrate back stretch. How can I? Oh yes, I can demonstrate. But first, let me take you down to the floor. I hope you guys can see me. Alright. So the back stretch. Alright. Alright. So this is the example of the back stretch. Just lie down and then stretch. But don't stretch too much. You can stretch until you feel discomfort. If you feel discomfort, don't push yourself. Alright. Next one is the abdominal stretch. Alright, abdominal stretch is actually like your workout. Hamstring stretch. Hamstring, our below, for example, like when you stretch, when you cool it down, yes, something like this. Shin stretch. Shin stretch usually we just stretch. How can I say this? We don't stretch our shin because there's muscle. Bench press exercise. All right. So this is when at the gym, when we lie down and bench press. All right, for our chest and quadricep exercise. Quadricep here at our front muscle. This is our quadricep. One of the exercise is yes we do squat. All right. That's one example of the quadricep exercise. For shin exercise, yes, you guys can do the calf raise, correct? Right, so I hope you guys can understand what I'm explaining. Okay, next part, the next stretch. Oh, give example. I'm sorry. Okay, we just go through. This is example of the next stretch. Particle circling of headlock. Yes, but don't circle too much like the first picture. It's actually damage with our next. The back stretch. This is the difficult one. You have to leg hug. But yes, go through. Abdominal stretch. Abdominal exercise. Yes, any workout that contain the abdomen can be do. Hamstring stretch. Yes. Shin stretch. Oh, this one is the difficult one. But yeah, you guys can use it. Bench press exercise. Yes. Knee bend, back. I'm kinda disagree with this one, alright? So when you do the bench press exercise, yes, you guys can bend the knee, alright? It's true, it's true. Yes, you guys can bend your knee because we want to put force, more force when we want to push the barbell. But it says here back arch is wrong. No, you must lock your back during your bench press because we need the arc. Because if you not lock your back, you don't have an arc, it's actually put pressure. aerobic. So I disagree with it. It's not. That's one I call as exercise. Yes, lunges or maybe squat. Oh, but please don't squat like this. And guideline for exercise. We're almost at the end of our class. All right. General guideline of exercise. Yes, no hyperflexion of the knee or neck. Yes, this is the crucial part of our body. If you hyperflex your knee, it will lead to the ACL, PCL, ACL, or even MCL, and you cannot be normal again. You cannot start normally. If you damage our neck due to the hyperflexion, yes, you may be paralyzed. Right? No hyperextension of the neck, knee, and lower back, as I mentioned earlier. No twisting or lateral force to the knee. Right? Please don't have any twisting to your knee. It can lead to serious injury. No breath holding during exercise. So, I want to teach you guys. If you guys do any exercise that involve weight or have force, so just remember. For example, when you do a bench press, so when you lift the barbell, when it go down, please uh, take a deep breath. So when you want to push the force, please exhale. Shh, shh. All right. So remember, if you any exercise that involve the push of the force, yes, you must exhale. Okay. When you push, exhale. When you pull, inhale. Okay. And avoid any ballistic passive stretch. All right. This is I'm gonna disagree. Okay, ballistic is a stretching that involve bouncy movement. You guys can do it, but please do it with the correct technique. Okay. This is the example of the Swiss ball exercise. Resistance machine for the back exercise. Yeah, this is one of the example. Oh shit, we already ends. That's great. Okay, guys. Okay, so I think that's all for today, and it's really good to see you guys. All right. So if you guys have any question, please feel free to ask me. I love a question, and don't forget to answer your attendant and the quiz as well. All right. And please, guys, I see no updates regarding your sport proposal. Okay, your supervisor regarding your proposal. All right. So that's all for me. If you guys have anything, feel free to ask me. And thank you.